Hello, dear YouTubers. How are you? During this winter season, which is very grave season nowadays, it is quite high winter. Temperature is very low in northern, northwest India. So, leading to various diseases which were controlled during the normal temperature or normal weather, they gets decontrolled during this winter season. And one of this is hypertension, that means elevated blood pressure. Now most of the patients which come to me in my OPD, which were previously controlled with the drugs, now gets decontrolled or their BP becomes high as they come in this winter season. And because of this high BP or raised BP, patient may get various diseases or various complications of the hypertension like stroke and myocardial infarction, retinal involvement, etc. So important is stroke and heart involvement. Second point is compliance of drugs. I am seeing it for the last so many years that the patients do not want to follow the advice of the doctor physician for taking एंटी हाइपरटेंसिव ड्रग्स. उनको अगर कहो कि भी आप बीपी की गोली रोज़ खानी है, आपको सुबह 9 बजे ले लो आप नाश्ते के साथ ही, तो उनको ये लगता है कि डॉक्टर साहब हमें रोज़ गोली खानी पड़ेगी, हमें तो गोली लग जाएगी सारी उम्र के लिए, अगर हम गोली ना खाएं तो हमारा चल सकता है. और मेरे को एक मेरा दोस्त कह रहा था कि तो सारी उम्र खानी पड़ेगी. तो इस टाइप की जो टेंट्रम्स हैं, टैबूज हैं, वो सोसाइटी में बहुत प्रिवेल करते हैं. तो रिपीटेड उनको समझाने पे भी कुछ पेशेंट्स जो हैं वो उसको इग्नोर करते हैं, और बिकॉज ऑफ दिस इग्नोरेंस द पेशेंट मे गेट द कॉम्प्लिकेशंस विच आई हैव टोल्ड यू. As you know, the condition of hypertension may lead to target organ damage. The 5 target organs are, starting from above downwards, is brain, then eyes, then heart, then kidneys, and then peripheral arteries. So out of these 5 organs, any organ can be affected by the high blood pressure, and the important one like brain may lead to brain stroke, that means अधरंग होना, या एक साइड की आवाज़ चली जाना, या एक साइड का आँख की रोशनी, कान का सुनने का चले जाना. सो ये सब फीचर्स उसमें ब्रेन स्ट्रोक में हो सकते. सेकेंड fatal cause it may lead to is heart attack, और उस हार्ट अटैक को संभालना बड़ा मुश्किल होता है जब बीपी की वजह से होता है. नंबर थर्ड इज किडनी फेलियर. आई हैव सीन patients of young age 40, 42 years, 45 years dying of kidney failure because of uncontrolled blood pressure. They have been advised by various physicians to get it or keep it under control, but they never followed the advice of the physician and ultimately led to the disease or the fatal kidney failure. Similarly, in the eyes, it may lead to retinal bleed, vitreous hemorrhage, etc., leading to permanent blindness. So, my video is about the thrust on the compliance of anti-hypertensive medicines. I want to make it inculcate in you people, YouTubers who are listening to this video, that if any one of you is having hypertension diagnosed by a physician, you must take the medicine as prescribed to avoid all the dreadful complications. Along with the compliance of medicines, we should also have our lifestyle changes. Now, various exercise which are advised to reduce this hypertension is I have shown in this folder. It is telling number one is dancing, number two weightlifting, yoga, then swimming, jogging, and cycling. These six exercises help in reducing the burden of hypertension, and secondly it helps the drug to get it controlled. And after this there are some do's and don'ts for patients of hypertension. What should we do? We should do we should do first eat healthy and fresh foods. Avoid fast foods, avoid fried foods, avoid excess of non-veg foods. Number two, take low sodium diet. That means जितना सब्जी में नमक है उतना लो, उसके अलावा एक्स्ट्रा साल्ट इन द फॉर्म ऑफ सैलेड, रायता, अचार, etc. chutney, that should be avoided. Then exercise, as this I have mentioned, it should be done regularly. That means 5 to 7 days per week and for a period of 30 to 40 minutes. Most important point, fourth one, that is go for regular checkup. If your doctor has advised you to come every month, you must stick to the consultation with your physician so that time to time he will detect any problem in you and accordingly he will guide you. And fifth point is avoid alcohol, avoid smoking, avoid non veg foods, etc. Then don'ts. What should we not do? Quit smoking, avoid junk food, avoid sedentary lifestyle. हम जो बैठ के टीवी देखते रहते हैं घर पे सोफे में बैठ के टीवी देख रहे हैं, इट शुड बी अवॉइडेड. वी शुड वॉक एंड वॉक एंड वॉक. डोंट अवॉइड हाइपरटेंशन सिम्टम्स. अब ये बड़ा इंपॉर्टेंट है. पेशेंट को अगर चक्कर आ रहा है, आंखों के आगे अंधेरा आ रहा है या आंखों की रोशनी की डिस्टर्बेंस फील हो रही है, वो क्या करता है, वो कुछ कुछ अपने हिसाब से सोचता रहता है कि आज मैं टेढ़ा सो गया था तो चक्कर आ गए, आज मेरे को टेंशन थी तो सिर दर्द हो गया. ये सब बातें अपने आप सोचता रहता है. तो वो इस चीज़ का उसको इलम नहीं है कि भी ये बीमारी, ये जो सिम्टम्स, इट मे बी ड्यू टू हाइपरटेंशन. As I have told in my videos on hypertension which are present in the YouTube Dr. Ashok Kumar Rana, in that video I have mentioned that symptomatic hypertension is very uncommon. Symptomatic means कि जिस पेशेंट में कोई सिम्टम्स होने चाहिए, तकलीफ हो पेशेंट को, ऐसे पेशेंट हाइपरटेंशन के कम आते हैं. और ये डायग्नोज कैसे होती है? ये कोइंसिडेंटल. जैसे मेरे पास पेशेंट कोई आया, टट्टियों उल्टियों से आया, खांसी जुकाम से आया, तो वी हैव ए टेंडेंसी टू गेट द बीपी चेक. तो उस टाइम डायग्नोज होता है पेशेंट के ये हाइपरटेंशन. तो कोइंसिडेंटल चेकिंग से ही हमको पता लगता है. अपने आप पेशेंट कोई भी आगे नहीं आता. या फिर जो पेशेंट प्रेग्नेंट लेडीज हैं, गेस्टेशनल हाइपरटेंशन है, तो पता लगता है. दैट इज PI, प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन. एंड important fifth point is avoid stress, mental stress, maybe due to official work, maybe due to family circumstances, maybe due to children's circumstances, that should be avoided in to the maximum extent. Now I will show you this folder. This is tips to control blood pressure. Now this has mentioned that keep your weight under control, exercise regularly, eat a healthy diet, reduce salt intake, reduce alcohol intake, and quit smoking. Reduce caffeine, monitor BP regularly, avoid stress, and visit doctor regularly. So these measures will help you keep your blood pressure in accurate levels, and they will help in the way to avoid complications. Now you can have this type of BP apparatus at your home. This is self monitoring BP apparatus, and you can get it checked yourself at your home once a week or twice a week, and keep a record of the blood pressure recording to show it to your physician whenever the visit is due with him. Secondly, latest, there is another instrument that is called ambulatory BP monitoring. The patient is given this instrument. This is instrument for ambulatory BP monitoring. We apply the cuff to the hand and attach this machine with it. Keep it for 24 hours with the patient. Patient should do all the work which he is doing regularly except to take bath. तो 24 आवर में जैसे हम 8 बजे रात को लगाएंगे तो अगले दिन रात को 8 बजे इस मशीन को उतार लेंगे, एंड द रिकॉर्डिंग इन दिस मशीन विल बी एनालाइज्ड बाय द कंप्यूटर along as a software. It has been put in the computer, and that will analyze that the BP levels in the 24 hours are like this. So from that we can also judge at which stage the BP is higher. So according to that we can tailor the dose of blood pressure in the patient. अगर किसी पेशेंट का बीपी समझो शाम को बढ़ता है, सुबह ठीक है, तो हम उसकी डोज इवनिंग में शिफ्ट करेंगे, और we can add one evening dose to the patient. So this is called ABPM, ambulatory BP monitoring. So with this I will complete this video, and I will request you to follow the precautions and to follow the hints which I have given in this video, so that you can lead your life nicely without any complications. Wishing you good health all the way. Thank you.